physiology. And then I went on to going to the University of South Florida, which is also in Florida. And I got my master's in medical sciences there. Yeah, I took about a 1 year for my gap year. And now I'm in my second year of medical school. I'm currently studying for my board exam, which I will take in April. I'm a child of immigrants. My parents are Colombian. I'm the youngest of 3 siblings. And I have a dog named Walter, and I'm excited to be here. So feel free to put questions in the chat or unmute yourself and ask questions. I was kind of telling them that I felt that this session might be most useful for me to answer any questions that you may have, whether it be related to pre-med or medical school or gap years. So I didn't want to talk as much. I more so wanted to answer any questions that you may have.
Yeah, so if you guys have any questions, you can use the raise hand function and we will, call on you, or you can just ask questions in the chat about medical school, Natalia, her journey, anything you want to ask.
Okay, so how did I go about studying for Mcat? I actually had the Kaplan courses, the Kaplan online course. I had tried the in-person version of it for some time, but I didn't really get much use out of it. And so basically it came with the books and the online portion, and it has like a study guide to it. However, I kind of like did my own thing. I studied for about 10 weeks. I had initially tried to do the traditional route and take it during my 3rd year, but I was like very heavily involved. And so I figured that that wouldn't be the most useful thing to do. And so I had postponed my Mcat exam and I had froze my Kaplan course. And then I decided to take it during my gap year. So after I graduated in May of 2018, I decided to do my Mcat that August. And the reason why I decided on August is because I was starting my master's program in August. And so I wanted to knock out the Mcat prior to doing the master's program. And so I took the GRE, I applied to grad school, took my Mcat, and then I started grad school. And so I actually dropped a link to my Mcat vlog in the chat because I feel like Mcat in itself can be like a whole topic. And so I kind of really touched upon like the heavy hitters and like how I went about choosing how long I studied and how I structured my studying and kind of like what was the most difficult and how many practice exams I did. I'm pretty transparent about my stats. I had a 505, I took the Mcat once, and I got into medical school the first time I applied. And so that's kind of how I went about with Mcat, but feel free to check out the vlog if you want more details. And if I still didn't answer your question, you can always DM me and I'm happy to answer. The next question was, sorry, you're right, this kind of moved pretty quick. What did I do for my gap year? Yeah, for my gap year, I went to the University of South Florida and I did a master's in medical sciences. And so since FSC starts in the summer, I ended up having to drop out of my master's program to start medical school. And then between my 1st and 2nd year of medical school, I virtually finished my master's. And so that's what I did during my gap year primarily. I would say during the summer, I studied for the Mcat. That's pretty much it. I had two weeks off between my last spring semester of my master's program and starting medical school. So I got my wisdom teeth taken out and just like hung out with family. What kinds of clinical experience did I do? I was an MA for a period of time. So I had that clinical experience. I was also a sitter in the hospital. So I basically sat like 24/7 with people that were Baker acted or people that were fall risk. Those were the primarily big hands-on like clinical experiences that I had. In terms of like shadowing, I did some shadowing in Colombia because I have an uncle that is an anesthesiologist over there. And so he was able to get me some shadowing hours there. And then I did some shadowing here in the States in like a lot of different fields, primarily family medicine. I did some urology, I did some plastic surgery shadowing. and then I did some neurology shadowing. But also, again, if you go on my YouTube, I kind of break down like all of my AMCAS application, and I indicate like how I basically showed schools what I did in terms of my clinical experience, and I described what my clinical experience was and the best way I presented that on my application. So if you want like the nitty-gritty details, I highly recommend going there. What specialty am I going for in medical school? If I know, coming into medical school, I was leaning towards OBGYN, but it wasn't like anything solid. And as I went through the different organ systems in medical school, I've found that I like a little bit of everything. And so I've kind of just like, you know, just been exploring a little bit more. And currently I'm in the reproductive system block, which is my last block in my didactic years of medical school. And so I've really been enjoying that. And so I've kind of really started steering towards OBGYN again. But I'm really just keeping an open mind until I start rotations and then going from there. I'm going to keep reading the questions in the chat, but if anybody wants to unmute and ask questions, also feel free as well. Did I do research? Yes, I did research in undergrad. I did two primary projects. One of them was with a physician in the FSU College of Medicine, and it was basically studying Parkinson's disease and the impact of Tai Chi on patients with Parkinson's disease and like their improvement in gait. That was one of the projects that I did. The other project that I did was the impact of blue blocking lenses on patients with multiple sclerosis. And then another project that I've been on for a really long time, which is also based in the FSU College of Medicine. It's called the ACTS2 Project, which is basically an organization that supports African-American caregivers for Alzheimer's disease. And I've been on that project for almost 6 years now. I primarily transcribed and code for that project. I transcribe and code the interviews for them to analyze them. And currently I'm not involved in research. I was, but I've kind of withdrew from different commitments as I head into my board studying. I just wanted more time for my studies and less commitment elsewhere. So that was my research as an undergraduate. Some of it kind of carried into medical school, but medical school can be very time consuming. So I do some research, but I kind of aim for things that were a little bit less demanding. Any extracurriculars I recommend? I definitely think every pre-med should be involved in some pre-medical organization, just because it's gonna guide you into what you should be doing and where you should be spending your time. So they will also like help you find shadowing hours, community service hours, you know, mentorship, things that are very vital as a pre-medical student. And also it'll give you more exposure as a pre-medical student. So I definitely think one of the extracurriculars you should do is pre-med related. And then other than that, I think you should do anything that you're remotely interested in, just because college is like going to be, you know, it's supposed to be some of the best 4 years of your life. And so you make sure you want to graduate with doing more than just staying in the books and, you know, getting a GPA. So when I was in undergrad, and again, you can see this in one of my vlogs, I kind of go in depth about it. I joined a sorority, a multicultural sorority, and I was still able to put that on my application because I kind of discussed how it embraced multiculturalism and diversity, which is so essential in the medical field, and how I'm very passionate about empowering minorities and kind of, you know, using that to make myself a more culturally competent physician. So anything that you really do that you're passionate about, you can always tie it back to medicine. Another thing that I did in undergrad for extracurriculars was I joined the student senate. So I learned a lot about like the legal aspect of student government in the university. And so on that, I was able to start the Women's Caucus at my university, and I was able to be a part of, you know, different committees, the Academic Honors Policy Committee, and work with people from different backgrounds in the university. So I was also able to use that on my application. But those are just some examples of, I guess, non-traditional extracurriculars that I did. But you can do anything you want. There's a lot of people that do sports. There's other people that do, again, like social fraternities and sororities. It just matters that you're interested in it and you can talk about it and always tie it back to medicine. Do I have any experience dealing with personal relationships while being in medical school, especially if your partner isn't in medicine themselves? Yes. So when I first started medical school, I was single, and I had kind of gotten into a relationship in my first year, and I was able to balance it very well. I will say the person, if they're not in medicine, it's a little bit more challenging for them to understand how demanding medicine can be. But I do see a lot of people in medical school in relationships, whether they're married or, you know, just in engaged or in just like a first staging relationship. So you can do it. I just think, you know, the effort needs to be on both halves. I'm currently single and I kind of love it because I do feel like my step studying requires a lot of my time and attention. And so I really couldn't imagine having a whole partner right now. Just also because I'm the type of person that like, I do like to spend, I guess like quality time is like my love language. And so if I'm not spending quality time, I just feel like I'm not in a relationship or not being like a good partner. So it really just matters of like both people being very understanding, you knowing your limits into like when you need to study and when you need to set boundaries, and then being accepting of those boundaries. But it is definitely doable. There's a lot of people that are married, engaged, have gotten engaged. There's definitely people that have broken up, unfortunately, but you know, it is what it is. But yeah, that's that. Would I suggest taking a gap year? I think it's on a case-by-case basis. If you need a gap year to do your Mcat or to build your application, yes, take a gap year. If your application is solid, you have a good GPA, a good Mcat, and there's not really anything else to add to your application that's going to make it significantly better, then I don't see why you wouldn't apply. Yeah, that's that. So I think it's definitely on a case-by-case basis. You need to kind of like sit yourself down and kind of see like, okay, do I have a strong application? Do I feel confident in applying? Because you don't want to rush it, because medical school applications are very expensive. But you also don't want to prolong it, because the longer you prolong it, you know, the longer you're going to be away from, I guess the further out you'll be away from completing, you know, your medical training and receiving a salary and paying your loans off. So I don't think there's a rush, but if you do need, I don't think there's a rush, but if you do need the time, take it, is kind of what I'm trying to say. Sorry, I just scrolled too fast. Did you do undergraduate research? If so, did you have any publications, or is it not required? Like I said, I did do undergraduate research. I did not have any publications. I did do a poster presentation. You don't need to have you don't need to have any research to apply to medical school. Does it help? Yes, especially at some institutions that are research heavy. I would recommend having research. Will it make or break your application? I don't know. It's just that the thing with medical school, it's like winning the lottery. Like you don't know how competitive the pool is going to be. It's usually always very competitive, but you know, at the end of the day, every school only has so many spots to offer, and you don't really know what's going to distinguish you from somebody else. So you want to come in with the strongest application that you can possibly have for yourself. So if you are able to do research, do it. But if you don't get the publication or the poster presentation, I wouldn't stress it. I think any type of experience is valuable. What MCAT prep books would you say are the best? I can only speak for Kaplan. Like I said, Kaplan was the books that I had and what I used. I would say I didn't spend a lot of time reading through the books. I think MCAT is one of those exams that practice is like the best thing to do. So doing a lot of practice questions and reviewing them is the best way to learn. And I'm using the same exact approach for my medical school boards, because you can learn the content all day, but if you can't apply it to, especially for how the Mcat exam is structured, then you're going to be struggling a lot. So all the prep books have literally the same content. What I did like about the Kaplan books is that they have the stars that indicate what is the highest yield. So when I was trying to get through the books or through my review, I hit everything that had like the most amount of stars first, and then I went back and kind of like looked at things with 1 or 2 stars. So that's kind of like how I used it. But I think the Kaplan course was good. It was very expensive, so it is an investment. But for me, I thought it was worth investing the time and the money in a course versus taking the Mcat multiple times, because I tried to self-study the first time kind of thing. What benefits do I feel the gap year provided me? I think the gap year really it wasn't really the gap year, but more so the master's program that I did during my gap year. I think it really allowed me to redeem myself. My undergraduate GPA was a 3.4 cumulative, and my science GPA was a 3.2 for undergrad. And so I felt like that really didn't represent my academic abilities to medical schools. And so I took it upon myself prior to submitting my application to apply to a master's program and start the master's program, in order to show medical schools that I, can perform academically well, which was not reflected in my undergraduate years. I just spread myself too thin as an undergrad. It's not that I wasn't smart enough and I couldn't get the scores. It was just I didn't put in the time that it required. And so I felt going into the application cycle, I felt that if they only saw my 3.4, that it would deter them from accepting me. And so that's why I decided to do the gap year. And I felt like within the master's program that I did, which I got a 4.0 in, it really allowed me to, I guess, redeem myself academically for medical schools, but also it really taught me how to study and gave me that time to learn, and through trial and error, like what study strategies worked for me. And although my study strategies have evolved from my master's until now, if I had gone straight from undergrad and studied how I did in undergrad, which I really didn't study much, I was a crammer in undergrad. If I used that same method in medical school, I probably would have failed out by now. So I really enjoyed the gap year master's program that I did, because it really allowed me to refine myself academically as a student, and to prove to medical schools that I can handle medical school. And it kind of gave me that confidence as well. Do I recommend doing a master's degree, research, or postback before applying to medical school? I don't think a research program is necessary for applying to medical school. But if you have a strong passion for research and ultimately you want to be a researcher, then maybe that is the route for you. In terms of the master's degree or a postback, I think it really depends on what your current academic course load or your current academic record looks like and what you can add to it that would be valuable. So I would do a master's degree if you've already taken most of the science courses that could possibly boost your GPA. If you haven't taken most of the courses that can boost your GPA, then a postback might be good enough. But most people that do postbacks tend to be people that majored in something that wasn't like pre-med related, and they're just trying to get their prerequisites done to apply to medical school. The master's degree program tends to be a lot of people like myself that are trying to redeem themselves academically, and they just do the same kind of classes at a higher level, and so you get a whole new GPA. If you do a postback, you have the same GPA. It just adds onto your undergraduate GPA. So for example, if I did a postback with my 3.4 and I took one class, it would just turn into like a 3.42. Versus my master's program, I had the 3.4 and then I had a separate GPA, which is a 4.0. And so but regardless, both are presented to medical schools when you apply. So it really just comes down to like what is useful for you. And also there's a lot of different master's programs. So it depends on what you want to do with your career. Some people do a master's in public health before medical school. Some people do masters in business administration. Some people do masters in public administration. It just depends what you want to do. But if it's a GPA related thing, I would definitely do something more science based rather than public health based. How did you manage your extracurriculars and keeping your GPA high? Well, in undergrad, I didn't manage my extracurriculars well with my classes, which is why I felt like I graduated with a lower GPA, which is a 3.4. And why I say that's lower is because the average matriculant right now has a 3.7 GPA in medical school. So 3.4 is, you know, a little bit below that. So I did have a lot of, and I don't regret any of the extracurriculars that I did and having to do my master's or whatever, but I do recognize that a lot of the time I spent in my extracurriculars was taken away from my studies, which was reflected in my GPA. So I think make sure you are getting involved because, you know, it is college and you're paying all this money to get an experience. So, you know, take advantage of that, but don't spread yourself too thin. And when you do, recognize that and kind of like, you know, pick and choose what you want to do and what you want to spend your time in. In my master's program, I only had 2 commitments. And I also didn't work in my master's program versus in my undergrad, I did work and I had extracurriculars and I shadowed and I did research and I did my classes. So that's kind of like why my GPA suffered. But in the master's program, I didn't work at all. I did shadowing very rarely. I did urology shadowing maybe like twice a month max. And then I had one volunteer commitment that was 2 hours every Monday. So in my master's, I was like very focused on my GPA because I was really aiming for a 4.0 because I knew I only wanted to apply to medical school once. And so I really sacrificed all my time and energy into my studies for my master's. If you can't apply to many medical schools out of state, what advice can you give to students who are limited to one state? So I was kind of in that same boat, not because I didn't have a choice, but because I didn't want to spend that much money. So I applied to all Florida schools, well, only Florida schools, and then 1 Alabama school, which was a DO school. I applied to 5 MD schools and 3 DO schools. And so I mainly wanted to stay in Florida because I did not want to pay out-of-state tuition. And then the only reason why I applied to the Alabama school is because my master's program had a partnership with them and would have basically guaranteed me an admission because of my GPA in my master's. And so I would definitely say whatever schools you're applying to, especially if you're applying to small, I wouldn't submit an application unless you feel very confident in your application. So the reason why I applied to so little schools is not only because I didn't want to spend a whole lot of money, but it was because my Mcat was a 505, which also wasn't super competitive in terms of Mcat. It also really depends what schools you're applying to, but I figured I'll apply small on my first try. And the main reason why I did that was because I felt like Florida State University was the main school that my application catered to. And I felt that if Florida State University didn't take me with how much my application screamed Florida State and with me meeting their stats, then I felt like no other school would take me, especially, you know, when it comes to MD versus DO schools. I think I did have a better chance for DO schools, but in terms of MD schools in Florida, 505 and a 3.4 with a 4.0 wasn't super competitive. My GPA could be competitive because of my master's, but 505 was still below the average of most average MCATs in Florida. But you only need 1 acceptance to go to medical school, and that is what I landed. So, you know, now I'm a rising 3rd year, and I only interviewed at 1 school, which was Florida State University, and I only got that 1 acceptance. I was denied from the other 4 MD schools, and then I had 2 interview offers for the DO schools, but I was already accepted to Florida State, and I was, you know, I already have a connection with them. So I was pretty dead set on going to Florida State, and that's kind of how it played out for me. But I definitely wouldn't apply to schools unless you really see yourself going there. And if you feel like you have a competitive application, because it's really expensive to apply to medical school, like very expensive. And I talk about the medical school admissions process in my vlog, and I break it down. And I highly recommend looking at that vlog because it has everything that you need to know and like different things of how you can save money, especially with the fee assistance program. So I can drop the link to that as well for those who aren't interested. How is online medical school going for you, and how are you managing through classes and extracurriculars being virtual? So it's going well. I mean, I do very well as like a self-directed study person. So I've kind of enjoyed not having like a lot of mandatory in-person things. I will say my clinical experience was a little bit more limited, unfortunately, but you know, it is what it is. There's not much we can do. I have narrowed my extracurriculars down a lot more, like I said, because I'm entering my board studying. And so I study like 12 plus hours a day, and I just don't want that many distractions or commitments. But Zoom medical school is kind of like, as a second year right now, I feel like I got the good end of the stick, because first years, you know, here at Florida State University, they start with gross anatomy. And so their whole like program and scheduling kind of got shifted around, unfortunately. And then a lot of third years struggled with the rescheduling of their board exams. So that was stressful. And then a lot of fourth years lost their match day and their graduation. So as a second year, I really can't feel like I can complain for the way COVID played out for us. I was still able to do my fellowship during the summer, which I had, you know, organized on my own. I was able to finish my master's virtually, so I was definitely productive with my time. And currently, I'm still able to work out and do the things that I love and have ample time to study. So I've just been really reaping the benefits of this whole quarantine madness and making the best of it. So where did I apply? I kind of just answered that question. Oh, well, I didn't say those schools. So I applied to 5 MD schools. I applied to FSU, UCF, FAU, FIU, and UCF. Did I say UCF? I did say UCF. Nova was the other MD school. Then for DO schools, I applied to LECOM, ACOM, and Nova DO. And so I, again, was denied from the 4 MD schools. I was accepted to FSU, and I received an interview for Nova, and I received an interview for ACOM. I think I was denied from LECOM. But yeah, if I did not get accepted to medical school in the first try, I would have applied bigger the second time, but things worked out. So I'm grateful for that. How was my interview? I only did one interview, and it was at FSU, and it was literally the best interview of my entire life. I walked out of that interview and I was like, if I didn't get accepted, then they literally just like really played me in these interviews, because I felt like they were almost trying to like convince me to go to FSU, which is kind of interesting. My interview experience was very positive, and it was very conversational, and I just really felt like that was a place for me. So it just went really well. And again, my application really catered to FSU, so there was a lot for us to like connect on, especially in my application, and especially with the faculty. Also because I had connections with faculty in FSU already, which was reflected in my application. There was just a lot of talking points, and I felt like my interviews went really well. And there's a whole vlog that I did about that too, and it's on my YouTube channel. It's actually my first video and what sparked my interest in starting a YouTube channel. So feel free to check that out as well. How has COVID affected my studying? COVID has not affected my studying because I've studied the same before COVID and after COVID. I do the same thing. I guess the difference now is that I don't have to go in person for things. At FSU, you have the freedom to decide if you want to go to class or not. There's some things that are required, but I'm not really big on attending classes. If I do, I watch it on 2x speed and it's recorded. But I use a lot of external resources just because I feel like they're more geared towards preparing you for the board exam, and that's just personal preference. It is a common thing in medical school and across all medical schools. And you will learn more about that when you're in medical school. But COVID really has allowed me to, I guess, be less distracted and focus more on my studies and on myself, which otherwise wouldn't have happened, just because when I was in school, I'm a big social butterfly at times. And so I would get caught up like talking with my friends, which doesn't happen anymore. How should pre-meds go about finding a med student mentor? Just ask, you know, whether it be through social media or mutual friends or pre-med organizations. Sometimes they're like, you know, ingrained into the pre-med organization. Just ask, sending a DM. A lot of the mentors that I have are like random med students that I just literally engage in conversation. At FSU in particular, we have a very like, it's a very collaborative environment, and everybody really wants to help each other. So when you come in as a first year, you have the option to get paired with a second year student, and they kind of take you under their wing and kind of give you all the ins and outs, you know, tell you what to study, what to focus on, what resources they use. And that kind of trickles down, and I do the same for first years that are coming in. And, you know, I do things like this where I'm able to help out. And if people reach out to me, like, I'm happy to mentor. I have a lot of mentees, and the first thing I tell my mentees is, if you expect me to reach out to you periodically, I'm not the one. Like, I'm very busy, but I'm always available. If you have questions or doubts, like, I will always answer. But, you know, find what you're looking for and just ask. It never hurts to ask. People can always say no, but, you know, you never know unless you ask. So that would be my biggest advice. What class did you take during undergrad that you believe is helpful for medical school? I would say anatomy was helpful, like seeing it. But I've taken anatomy, like I took anatomy in high school, I took anatomy in college, I took anatomy in my master's program, and then I took it again my first year of medical school. And you can't always remember everything, but anatomy, from the amount of times that I've seen it, it tends to be one of my stronger suits, especially because I'm a visual learner. Things that, you know, weren't helpful, like orgo, you don't see that ever again, like literally ever again. I failed orgo when I was in undergrad. It was the only class I've ever failed in my entire life, and I retook it. I failed it with a D, and I retook it and I got a B. Never saw it again. Chemistry, you never really see. Biochem comes up for sure. Biochem, all of biochem, I still have to learn it and relearn it, because I continuously forget it, because it's one of those memorizing things. But yeah, genetics is still seen in medical school. That's pretty much it. Psychology. Yeah. Medical school, it's at a different depth and a lot more clinically related than it is in undergrad. So you'll see similar things, but it's just presented differently. And also in undergrad, you don't care to remember anything. In medical school, you just can't forget it. So I would say that's a big difference. Even if you learned it in undergrad, you probably won't remember it. But yeah. What do you think are important factors to consider when deciding which and how many schools to apply to? First of all, make sure you apply to the fee assistance program, even if you don't think you'll qualify for it, because it allows you to apply to, I think, 15 schools for free. I think money is a big factor. I think deciding whether you're competitive or not, and then in order to decide whether you're competitive or not, you got to know which schools you're trying to apply to. So for example, I had a 505 Mcat, and I applied to FSU because FSU had a 505 average. I did not apply to USF because USF, had a 513 average. No, a 516 average, And their recruiter told me to my face, if you don't have a 513, we are not looking at you. So I was not going to waste my money or my time or my dreams and my hopes on applying to USF if I knew they were not going to look at me and they were just going to take my money. So I think it really matters on like what kind of application you're building and how competitive you are for that school. And of course, money talks. Medical school applications are very expensive. If I had all the money in the world, I would have applied a lot bigger without caring, but I didn't, unfortunately. So if you do have a lot of money to apply, then feel free to apply to as many schools as you want. I'm a psych major. What tips would someone give me for, what tips would someone give me for studying biochem physics section of the Mcat? Thanks for taking the time to answer these questions. So regardless, even though you're a psych major, you should be taking biochem and physics prior to taking the Mcat. In undergrad, you need those classes regardless to apply to medical school. So everything that you learn in those classes, I would just pay very close attention and try to remember it, because everything will come up on the Mcat. Some people have theories that some things are more prevalent than others, but you literally don't know what's going to be tested more. But I would say chemistry is a lot of like practicing and applying. Bio is just memorization, to be honest. And physics is a lot of practicing and applying. The biggest challenge about physics is that you don't have a formula sheet. So you have to remember all the formulas and be able to apply it. And so for all those three things, it really comes down to practice questions and applying it. And whenever you get a question wrong, you have to really review it. And if there's a constant trend that you're seeing of things that you're getting wrong, then you need to go back and like start at the bottom of the fundamentals of that specific topic and relearn it. Because if you keep getting it wrong, it's obvious that you don't know it. And if it keeps popping up in practice exams, then it's probably high yield. So that would be my biggest advice. For cars, which I know you didn't mention in there, it's a lot of, again, practicing reading passages really fast and knowing the tricks to recognizing what they're asking before they ask it. Yeah, but my link for the Mcat studying is posted in the chat somewhere. So I'll post my link to my overall YouTube channel at the end for anybody that missed it. How did you get the research? Sorry, how did you get into the research you did? I literally just emailed a lot of professors and read about their research prior to emailing them and catered my email to their research. So if they were doing breast cancer research, I was very interested in breast cancer research, and I was very eager to get involved on their project. And I saw all the work that they were doing, and I thought it was phenomenal. If they were doing Parkinson's research, I was very interested in Parkinson's research. And that's just kind of how I based my emails. And I sent about 15 emails. And I specifically targeted the FSU College of Medicine because I thought it was killing two birds with one stone, because I was able to get onto two projects with professors in the College of Medicine, which both wrote my letters of recommendation for medical school, and were both very well known in the College of Medicine. So when I applied to FSU, I was able to pick those letters to be sent to FSU. And in both of my interviews, both of the professors were brought up because it stood out that they were on my application. So if you can kill two birds with one stone in any part of your application, I would highly recommend it. But again, it comes down to just, reaching out. And the worst thing people can say is no or just not answer. But I think shooting your shot is the overall theme here. For shadowing, it is best to focus on shadowing people in the career you're interested in, or is it better to shadow people of various medical careers? Shadow anything and everything you can possibly get your hands on. I think shadowing is very scarce. I was not particularly interested in urology. I had no idea what urology was, to be honest. I thought urology, for lack of a better word, was like a penis doctor. And I literally learned that urology has to do with the whole urogenital tract for, primarily men, but they also work with women as well. So I wouldn't have learned that had I not done shadowing. And I think it's a really cool specialty. So I think any type of shadowing experience that you can get your hands on, I highly recommend it. If you are interested in a particular career, I would definitely recommend trying to shadow that, so you know early on if that's what you're interested in, and what you're ultimately going to settle on. But anything that you can get your hands on, I think is helpful. I will say though, you should do primary care at least once, just because a lot of schools are primary care heavy, and those are the fundamentals and where you'll see the most diverse patient populations. So you definitely want to aim for getting at least one primary care physician under your belt. If you're applying to a DO school, you definitely want to shadow a DO physician, because most DO programs require a DO recommendation letter. And there's a lot less DOs in the United States than there are MDs. So, if you're going to apply to a DO program, you definitely want to keep that in mind. How did I get letters of recommendation? I just asked. I also I didn't ask letters of recommendation from people that I didn't build a relationship with. So I kind of went into a class with the goal of getting a letter of recommendation. And if I was doing well in the class, I would make the effort to ask questions to get my face recognized by the professor. And so there was letters of recommendation that were, classes I got A's in, but there was also like classes that I got B's in, but I worked really hard for that B so that professor could speak very highly of me. But I would definitely say the main thing is establishing relationships and keeping up with those relationships. For medical school, it requires 2 science letters usually, 2 non-science, 2 science, 1 non-science, and then some can do like 2 character letters. So every school is kind of different, and you're able to change it for every school. But character letters typically come from like, the sponsor of a club or a research professor. So for example, I had research professors, especially from FSU, write my letters of recommendation and stuff like that. But it definitely just comes down to asking and reaching out. And again, I talk about this in my vlog on applications, and I give tips on what you should prepare prior to asking for a letter of recommendation to make their life easier. Is it too late to look for shadowing, clinical volunteering, etc. at the start of the second semester of sophomore year? No, it's never too late. I was doing clinical volunteering up until my master's program, and I was shadowing still in my master's program. I shadowed in my first year of medical school as well, just because I wanted experience. So it's never too late. Tips for staying motivated and preventing burnout: doing things that you love and staying healthy. So like eating good food, getting good rest, exercising. Those are all really good ways to prevent burnout. Staying motivated, I kind of plan fun things to do here and there with friends. I set goals for myself. That's pretty much it. Right now, I have my board exam scheduled for April 16th, and I have a trip to Hawaii scheduled for like May 20th. So that's my motivation. Everybody's different, but I would definitely say it's a matter of like spacing and within your study sessions, like, doing things that you love and things that are healthy. I worked out literally before I got into the Zoom call, and I'll finish my workout right after the Zoom call, and I'll eat something really good, and then I'll get back to studying tonight. So that's kind of like how I, get a breath of fresh air and, go back to studying with more energy. Does the kind of research you do matter? No. Say it's not directly related to medicine, but it's still scientific research. That's awesome. It doesn't matter what kind of research you do, as long as it's research. And it's, especially if it's something you enjoy and you can talk a lot about. You can literally do anything not related to medicine, but as long as you can talk about it and tie it back to medicine, that's awesome. I applied to 8 medical schools, 5 MD, 3 DO schools. Lana's using Kaplan and I'm doing Blueprint. Okay. What are all the things that we're required to have for medical school applications? I'm going to drop the link for that at the end. Sorry, go ahead.
Why don't I read through some of the later questions, because some of them are kind of asked.
Okay, yeah.
Repeat. So yeah, let me just, since we're getting closer to the end. You kind of mentioned this when we were talking, but can you talk a little bit about, as you know, someone that's a little bit more of a social butterfly, how it's been kind of managing right now, and when you were in undergrad, like having some sort of social interaction and studying?
So my first year of medical school, well, are you talking about undergrad or medical school?
Both.
Undergrad, I was a social butterfly. I definitely spread myself too thin, and it kind of like affected my grades. But I think it's just like having balance. So like definitely don't be a social butterfly the week of your finals. Right after you take an exam, that's your time to like, you know, splurge, do whatever you want. But the closer you get to your finals or your midterms, that's when you really need to buckle down and study. Now, if you keep up with your studying throughout, you know, since day one, then you can do a little bit of partying here and there and not have much to worry about. Now, if you're like me in undergrad, I would like do whatever I want for like 2 weeks and then like buckle down the last week and, you know, get a whatever grade on my test, which is why I had a 3.4 GPA and what I don't recommend. Now in medical school, I'm always studying. Like I start studying after I finish my last exam, like, you know, so that's what I recommend, just like keeping up with the material and knowing when you have more free time than others. If it's a hard, you know, block or a hard exam you have coming up, then you just gotta suck it up and not be a social butterfly. There will be time to party and time to do whatever you want and travel, but not when you have a really big test coming up.
Yeah, for sure. Just a clarification question. In your application video, is there like kind of like a timeline of like when you need to do certain things like during the application process?
Not really. So the way applications works is it's rolling admissions. So the application I put when the application opens and, you know, when's the first day you can submit it and when's the last day you should submit it, but it's all up to you. The earlier the better, because that's when the most spots are available. So the application opens May, the earliest you can submit it is June, and they'll post those dates for you on the AMCAS website. And the AMCAS website should be your best friend if you're applying to medical school. It also indicates when's the absolute last day that you can take MCAT. So for me, it was September 19th, and I literally have not forgotten that date because it was literally stressing me out. So I took my MCAT by August 10th. I did want to take my MCAT earlier, but just the way my graduation was set up and like things that I had planned, I couldn't take it earlier. So that's just how it worked out for me. And then when I walked out of my MCAT, I didn't feel super confident. So I was already planning to apply the following year. But since I scored a 505, which was FSU's average, that's when I decided to apply to FSU. And it was a little bit later in the cycle. I didn't get my application in until October, and I didn't get my secondaries in until November, which is pretty late in the application cycle. But I felt really confident in my application, in particular for FSU. So I went ahead and I submitted an application anyways, and, you know, it ended up working out. But, you know, it's rolling admissions, so the earlier you get it in, the better. And all those dates are available on the MCAS website. And the only reason why I didn't put in my video is because they tend to change a little bit every year. But yeah, that's kind of like what the timeline is. In terms of like letters of recommendation, you should be, I think they're good up to like 2 or 3 years. So you kind of want to maintain those relationships so you can get fresh letters. But also if it's like, you know, a professor that you took a class in, you kind of don't want to ask too far out from when you took their class, because then they're going to forget like your performance kind of thing. But yeah.
Yeah, great, thank you. There's definitely a good timeline on the AMC, so definitely check that As far as like active learning and your studying styles, are you using stuff like Anki or any other services online that would be useful to integrate into our studying?
I use Anki. I think Anki would, when I was an undergrad and in my master's, I was a Quizlet person. I never knew about Anki in undergrad. I heard about Anki in my master's program, but I was so like used to Quizlet that I used Quizlet. Anki is very helpful in medical school because there's a lot of decks that go along with the different programs that most medical students use. So I do use Anki. I use Boards and Beyond to cover my material. However, I don't think that is necessary as an undergraduate. It's more for medical students. I do think Sketchy Micro and Sketchy Farm are very helpful for anybody taking microbiology and anybody taking pharmacology. Those are the main like external resources I use. Besides that, you know, just, oh, I have my first aid that I annotate like all my notes in. But that's my main study strategy. Like I will watch boards videos, I would do the cards, annotate my first aid, and lots of practice questions. For practice questions, again, this is all like, you know, med school related, but I use USMLE-RX, and now I'm using UWorld to prepare for my boards. But as a pre-med, I think, you know, your lectures are fine. I do think Anki can be helpful if you're a flashcard person, but Anki, it tends to be, you need to keep up with the cards for it to be effective. And yeah.
Perfect, thank you. Let's do maybe like 2 more questions. If we already have one through that. I guess we will maybe just do one more. As a medical student who was kind of in our shoes not too long ago, do you have any like last piece of advice for us as pre-med students and, you know, being in the pandemic and kind of feeling a little defeated and not getting all the experience that we would like to? Hopefully that will be coming back soon.
Yeah, I think number one is don't compare yourself. I feel like that's like the biggest thief of joy is like comparing yourself to others. There's always going to be somebody above you and somebody below you. And if you're dwelling so much on that aspect, then you're not going to be investing enough time in yourself, which is what really matters. And the same thing goes for like when you're applying, when you're in medical school, you know, when you're in medical school, if you're applying to medical school, you tend to be like one of the big fish in the pond. And then when you get into medical school, you realize that you're just in a pond with a whole lot of other big fish and you don't really stand out as much as you once did. And that can eat away at you if you don't remind yourself that you don't need to compare yourself to other people. You're on your own journey. And I think, you know, constantly reminding yourself of that is essential. In terms of dealing with COVID and not getting the experience, literally it's a world pandemic. So you're in the same boat with millions of other people. So I wouldn't dwell on it, but also be proactive, right? So there's absolutely no excuse why you can't be studying for Mcat now. If your Mcat got rescheduled 75 times, that, you know, that's not your fault, you know, and try to cope with that as much as you can. But, you know, things that otherwise you really can't be that social nowadays. So you might as well take advantage of that and study as much as you can and get like really good grades. If not being social is really eating away at you, plan things that are safe with your close friends and get the fresh air that you need. But I think, you know, trusting the process, being patient, being compassionate with yourself, and understanding that it's, you know, imposter syndrome and test anxiety and feeling of inadequacy is always a work in progress. I deal with that stuff every single day, literally. So it's always a work in progress. It never really disappears. You know, you constantly have to remind yourself that if you are accepted to that school, you belong there. And although the journey was not easy, it is worthwhile and it will continue to be worthwhile, especially when you graduate and you become a doctor and you're doing what you want for the rest of your life. And the pay is a plus, of course. So, just being patient. Time is going to pass anyways. So just don't rush it and trust the process.
Thank you so much. That was great advice. Definitely agree. And thank you so much for just being so honest and giving the best advice you can. I linked your Instagram there, so you guys follow her. She's awesome and gives amazing advice, and yeah, she's great.
I linked my vlog if anybody's interested as well.